Thank you so much, guys. Thank you for watching my videos. Thank you for subscribing to my YouTube channel. And I request, please, if you've not subscribed, please subscribe to my YouTube channel. And also, please like that you share with your friends if you find this interesting. And also, please hit the bell so that you're notified when I put up a new video. I plan to put a video every day, and I hope this is gonna make a difference. The whole analogy about 10,000 hours, doing something, being a practitioner of something for 10,000 hours, you become an expert. I don't know, for this new venture for me, I don't know how I cover the 10,000 hours, but I'm learning. I'm already learning. Like, it's never been like this, learning to speak in front of a camera, learning to be coherent and even being audible. I'm struggling a lot with setting up my audio. Sometimes there are funny noises that comes from the mic, my microphone. And sometimes it takes my hours, like my minutes, trying to find out how to get the best audio. Man, it's a whole different ballgame. What I've even realized now that I've been doing this content aggressively for the last maybe a month and days, is that even the people who put up content every single day, or some good, nicely edited videos and like crazy good stuff, man, it's a lot of work. Sometimes you just sit down and watch a video, and then you criticize, then you give your feedback. You say, oh, well, I didn't like this, just what are you talking about? Man, realize that it takes a long time. It takes hours. It takes expertise. It takes knowledge. It takes, awareness of how you just present your content for it to be likable, for it to please people, for it to be valuable, at least adding value. That's how people resonate with what you're doing. But I'm new in this. I'm a kid who's trying to learn how to walk the steps, but I'm willing to put in the hours. I'll try my best to put in the hours for this production to be something that you like. More importantly, for the message to be what you guys like. Please, as I say that, please, I request that you please make a comment on how you think we can make this best, what you think I should improve on, or some things that don't add up with my content. Just watch the whole video, please. Sometimes my videos are 10 to 30 minutes long. It's a long video. Man, sacrificing and just listening for the 10 minutes, for the 25 minutes on my channel, please, I don't take that for granted. I appreciate you and I thank you. Please, I request that you subscribe, please, and share the content. It's what it is, and I know that this is gonna take us a long way. So today, I'm making this video to just talk about, I talk about mostly experiences around healthcare. And tonight I'm going to talk about like some things that don't make sense, especially working as a registered nurse in the hospital, So it's just some kind of paradox or paradoxical situations that I find patients to be in, or even like people who are close. It's just a general observation. It's not cast on stone, but at least things just happen. You never know. So tonight I'm just gonna talk about some situations that are like don't make sense at all, that are very contradicting. Situations that really don't add up. Like, for example, in healthcare, we talk about at times you have patients who've been diagnosed with conditions that need dietary modifications. So you have renal problems, for example, and you need to be on renal diet. That means that you'll be censored from eating some specific type of food that will harm your kidney. So you are diabetic, for example, you need consistent carbs diet. There's some type of food that you need to regulate the amount that you consume for you to remain alive, at least to elongate your life, or at least you keep yourself away from diabetic complications. You have to adjust your diet. So by the way, even having said that, also I may go ahead and give you an example. Sometime back, my grandmother was diabetic, and those times, there was no aggressiveness in diabetic management, like administration of insulin, doing checks, blood sugar, random blood sugars check, and then they do dietary modification. So for her, the kind of knowledge that was there for diabetic management was intensely around dietary modification. So what they did out of ignorance was to cut sugar from her diet. So actually, the first time when she was diagnosed, she ignored that information and said, what are you talking about? Like, now I can't eat sugar. I can't eat some specific type of bread and food, I can't eat what I want, like it was a joke. She thought it was a joke, but every time when she ate it, she ate raw sugar and a high amount of carbohydrates. She could go into diabetic coma from high blood sugar, and sometimes she could go to hypoglycemia, that's low blood sugar, until she got to a point where she now accepted that, okay, fine, then if this is what is happening, then this is true that I can't eat a lot of this kind of food. So she stopped. But what was even more depressing was the fact that she could not eat what she liked. She was put in a dietary adjustment models that ensure that she doesn't eat what she liked. So what she told me was that there's no way you guys can tell me that I can't eat sugar, because I've worked so hard over the years, and then now you tell me that I can't eat some type of food. It's very paradoxical. It's very contradicting, by the way. Now, look at even the people who are so rich. I see people with a lot of money in the hospital. What that means is that they have all kinds of foods in their homes. And yet, when diagnosed with some lifestyle diseases, they are supposed to adjust. They can't eat some specific type of nice food that they've been eating over the years. And that changes for them forever. So here is someone who has the resources, has the money to buy whatever they want, but they can't buy because they've been told that, you know what, you can't eat this type of food, that now your new regimen is you have to eat this different kind of food, which is sometimes even not sweet, not good, not appealing. It's good, but it's not appealing to them. And it's some of the things that they really worked so hard to get, and they can't eat them. They can't buy those kind of food. They can buy them, but they can't eat the food. They have everything they need in terms of food, but because of health conditions, doesn't make sense at all. Doesn't make sense, guys. It does not make sense. Look at, for example, another way we say. Another example is you find people, very rich people, they have the resources, they have very nice cars. Not one, not two, not three, not four, but many cars. And now they're told that for you to be fit and to keep your body in good shape, you have to walk long distances, long places, so that you can get fit. And we know that when you have tools like your car, it's supposed to help you move around, but now it's very contradicting that now you're supposed to walk again to do exercise, to exercise your body. and that you can never use them as you wish, that there's now a new requirement that you have to work. And in that case, you are trying to avoid work, but in the end, again, you're supposed to work. You're told that that's the only way. It doesn't make sense at all. It does not make sense. It does not make sense that it happens that way, you know. So even look at, for example, in healthcare also, you find there are kids or people who've never been immunized against diseases. They've never had vaccines. They eat, like for example, street urchins. They eat food from the roads, from their streets. You know, it's not clean. They eat dirty food. You know, they don't care what they eat, even balanced diet or stuff like that. But you see, such kind of people also, you find sometimes they don't get sick. They don't get sick at all. And you find people who have received all manner of vaccinations. They've gone ahead to even now buy their super expensive vaccinations against weird diseases. They can afford them, those vaccines, and they've received them. But those are the people, sometimes when they contract a disease, they drop dead. And this other caliber of people who have no vaccinations at all against no disease, the same people live for so long. They eat food from the road, from the dirty, dingy places, but they never get sick. They never get sick. Look at the people who are living large, like they have everything. They go for medical checkups. You see, just a small infection, it throws them off. Or just a small contamination, like bad food, they diarrhea like crazy, my friend. But these people who eat food from the streets, like street urchins and such kind of people, those people never get sick. They never get sick. It doesn't make sense. It does not make sense at all. It doesn't. It doesn't make sense. So at times, by the way, in life, I think what you want so bad, like you really want that thing, sometimes you don't get. Sometimes you don't get. Like I've seen in healthcare, I've met couples or women who want to get pregnant. They really want to get pregnant so bad. You know you've never met a woman who want to get pregnant and they can never be pregnant. They can do anything. They can do anything. They're the same type of mindset, by the way. When you meet a woman who wants to have an abortion, you can't convince that woman to keep the pregnancy. I've met so many women who want to abort their pregnancy. You can never convince them otherwise. They have to go for it. So women want to conceive and give birth to kids really bad. Like they really want to get pregnant as bad as it is. They never get pregnant. But some of the people, like people who don't even have the resources, do you see how fertile those people are? Any slight sex, anytime, they get pregnant. Like one time, they get pregnant easily. The people who don't have the resources, who can't like take good care of children in terms of providing for them resources, the food and wholesomeness of taking care of children and keeping a family. Those who don't have the resources, man, it's so easy for them to get pregnant. They get pregnant so easily, by the way. Very easily. Very easily. You see, like the ones who don't want, they easily get pregnant. Easily. The ones who want, on the other hand, they never get pregnant, man. they never get pregnant. They try all manner of things. They're so obsessed on this pregnancy thing, and they are like, God, I want kids. Have you seen some of the things such people do? Like go for prayers, people like touch them on their uterus and they squeeze them, the pastors, some crazy kind of stuff. I've seen people drink some crazy concoctions in the name of they're going to get fertile and get pregnant. It doesn't make sense. It's useless. It's paradoxical. It's contradicting that someone who wants something really so bad, you never get it. Even in life, generally speaking. Have you ever seen people, like, you're looking for something, like, so bad, you want it, and the next person has it, and you don't see them struggle like you did. Like you are struggling to get something very bad. The other person has it easy. I mean, it doesn't make sense. It doesn't make sense at all. Look at this situation, for example. I moved to the US a few years ago. And what I see in terms of the environment is, what I see just jobs. I see jobs everywhere. That's the dream of every African country. Like, are they able to have a government or entrepreneurs who are able to create employment, that they have jobs and people are able to get employment to be able to live and live their lives? Are they able to do that in Africa? Big problem. We are trying to solve that. In the US, on the other hand, jobs everywhere. Every business in the US is looking to employ someone. They're always short of employees. Always short of employees. And yet, by the way, some of the people also, they don't know that. They are complaining about joblessness. They think it's the worst time of their lives, that hell is breaking loose. There are no jobs. Yet, there are jobs everywhere. They have the jobs easy. Like, jobs are everywhere. And yet, us in Africa, who are looking for jobs really bad, people bribe a lot of money to get jobs. They bribe a lot of money to get very low paying jobs, which I don't know how long it will take them to recover even the money they bribed. People are looking to connect with people to give them jobs. They want the jobs so bad, yet they can't get the jobs. And look at how easy and many jobs are in the US. It doesn't make sense. Doesn't make sense at all. It doesn't make sense at all. It does not make sense. Some of these things we can't even explain. I can't even say what is going on. That's why sometimes I think that some of the solutions, some people tell you that these are the 5 steps you have to take. These are the 5 advices that you need to get ahead. Some of those things that you're being told that are the solution to your problems are never solutions to your problems. As a matter of fact, they are trying to sell something to you. This is the proverbial statement that I think I have to make, and I've always thought about it, that if you are not in business, you are the business. You are the business. You are the business. In healthcare, I look at times people who are from rich families, they eat all manner of foods. They have everything they need. They even go for doctor's appointments for dental checkups, the dentist to check on their teeth. And yet, they have the most problems, by the way. They have the most problems. Dental problems. And some some people who actually don't even have the money to buy the food. They don't have money to buy the sugar. They don't have money to buy the salt. They have the best teeth. Have you ever seen that? They have the best teeth. It's very contradicting. It doesn't make sense at all. But you can never decode life. Life has to happen. And these situations also, they make even life more confusing and contradicting itself as well. When I was working in obstetrics, that's a maternity and delivery, I made an observation. I worked in a big, free government hospital where there's every Tom, Dick, and Harry. The hospital is in Nairobi, Kenya. Women come from low socioeconomic places. They come to deliver. They've not had any special treatment. Most of them have not gone for any antenatal care clinics, for any assessments. They come for the first time and they're giving birth that day. Most of those women have the easiest delivery ever. They never have any complications. They've lived their life, normal life. And yet, I also worked in big hospital, private hospital, maternity wing, where women who give birth. And the kind of complications that I saw those times in those units, those are the women who are treated with, they're so sensitive. The small pains, they are given pain medications. They are given all kind of privileged treatment in their maternity and delivery. They are given, everything they need. Then they also presented with so many conditions in those units. They had eclampsia. I know it cuts across, affects all populations, but you could see those complications less in the bare minimum hospitals where there's no preferential treatment, at times no pain medication during labor. And those low socioeconomic women, they could just go deliver. They did not expect any preferential treatment, any tender treatment. They didn't get that, and yet they gave birth the easiest. But these other women, contrary also, I think they went for antenatal care clinic so many times, probably done countless CTs, abdominal ultrasounds, to check on the baby, to check on the sex. Some of the other women who go to low socioeconomic serving hospitals, they've never had an ultrasound in their lives to check on the baby during the 9 months period. They don't know what they are even carrying, but they are hopeful that they give birth to a baby. They even don't know the sex. They are delivering to see the sex during the delivery because they don't have money to do ultrasound to determine the sex of the baby. That happens all the time. It doesn't make sense. It does not make sense, guys. I don't think it makes sense. And life is life happens. Life happens, I'm telling you. In healthcare, when you work in units where there is platform for diagnosis of terminal illnesses like cancer and long-term care diseases, long-term care places, you realize life is very humbling. That at times we talk about people who drink the most alcohol, people who smoke, the smokers, as being predisposed to get lifestyle diseases like cancer, maybe lung diseases, COPD for the smokers. For the alcohol people, you get cancer also. People still drink soft drinks, and still we're being told that there is this kind of diets. People, I have seen clean people, like they eat clean and they're as healthy as a fido, being diagnosed with a life-threatening condition. They didn't even have the history in their family, but still they've been given a crazy diagnosis. They've been given a diagnosis. They don't have any predisposition. And even in healthcare, we also say, at times, you ask, what is the cause of this disease? What is the cause of this condition? What's the cause of this condition? What causes this kind of disease? We are always finding the causes. But in healthcare also, we have what we call unknown cause. Can you imagine that? That even you have a disease which we don't know what causes it. You have a disease that you don't know what causes it. Come on, guys. Does that make sense? It doesn't make sense at all. Guys, thank you so much for watching this video. Remember, I request that you like, comment on my videos, please. Just subscribe to my YouTube channel, please. Just a request, please. Thank you so much, and I'll see you next time. God bless you. Bye-bye.